So looking at my professional development plan, there are some things this semester that went really well and some that absolutely didn't. You can see my first goal was to submit my thesis for submission to NATA by November 15th. That did not happen. Why it didn't happen? Partially because of the nature of the study. I had a lot of trouble in terms of recruiting participants, maintaining participants, and then a lot of scheduling conflicts. It was really difficult to balance my schedule, my supervisor's schedule, the participants, the lab, the research assistant. There was just a lot of components that went into it that made it really difficult to make that November 15th deadline. But looking into next semester and my action plan, my goal is to have all of my data inputted into an Excel spreadsheet to run my stats by my first research meeting after Christmas break. Next goal in terms of scholarly work was to submit my EBP paper by October 1st. I did meet that goal. I've submitted for several revisions, hopefully the last of which was submitted yesterday. So why that one happened, I think it was really good collaboration between myself and then the other people working on the paper in terms of, getting revisions back quickly, fixing them quickly, and having conversations about the paper on a regular basis. My third goal was sort of a future goal and where I see myself going in the next coming fall. I want to do a project with the Global Rating of Change and FMS. I started that project in terms of the global rating change aspect of it through my long-term assignment for clinical this semester, collecting data with patients for global rating of change. But now I do have to make sort of a plan in terms of when, how, what for the functional movement screen and how that project will tie together. And then the last goal, I did meet LGBT workplace discrimination and sport and athletic training. I did submit that to the journal that that was my goal. However, it was not accepted. So looking forward to submitting that to the Journal of Contemporary Athletics, hopefully in February, March, right after I finish my thesis. So how I'm going to sort of make that happen, just having conversations with the two other people that are on the paper with me and sitting down and making sure that's a journal that we'd like to submit to, or any revisions that we need to make as it wasn't accepted in the first journal. In terms of sort of educational goals, most of my goals were surrounded by manual therapy class, because I really did think that most of my growth this particular semester would have come from techniques and approaches learned in manual therapy class. First goal, learn new techniques and application of the cervical spine evaluation and treatment. I think that I met this goal. It took me a long time to meet this goal, and it was absolutely not met by week 5, but I think that I used the resources and the patients that I actually had that were symptomatic in this area and, used the techniques that we had learned, and then I think I solidified my knowledge in terms of a couple of the techniques that we had learned on the DAT face-to-face weekend. Secondly, to learn a new technique and application of thoracic spine and manual rib evaluation. I sort of 50-50 met this goal. The thoracic spine, I feel much more comfortable with in treating. However, I didn't have any patients that were symptomatic that I could really practice on. So while I think that I would be confident in the area and I could apply all of these new techniques that I learned, I can't really measure this yet because I don't have any patients that are symptomatic. So in terms of where we're going with my professional development plan in the future and in the next semester, I think that I'll be able to actually immerse myself in the content more so than I did in the fall. Obviously, I had a new position and also data collection, and things in the classroom didn't really click the way I wanted them to this fall. Why that was, I didn't balance clinical work and academics evenly. Most of my effort came into my clinical practice and completing my thesis. And while those two intertwine with my academics, I don't feel like I put in enough effort into my academic side as I probably should have this semester. I think I prioritized my clinical practice a little bit higher. So reflecting back on that and where I want to go next semester in the spring, my workload in terms of clinical practice has drastically declined now that I'm not in season. So I think I have a better opportunity to fully immerse myself in the academic side of the DAT, not only with sitting down in an actual class this semester because I'm taking applied sports psychology. So I'm really looking forward to having conversations in the classroom because that's something that I do miss in terms of transitioning from the master's and the doctorate program. So looking forward to that, as well as just fully immersing myself in the rest of the classes. If I had to give myself a global rating of change number, I would probably give myself two different numbers depending on which side of my education I'm talking about. So if I had to talk about global rating of change in terms of clinical practice, I would probably give myself a 7. From where I was at this time last year to where I am now, I can't imagine not making the transition to the volleyball team because I think I still would have been stuck and really not growing as a clinician and not even knowing that I wasn't growing as a clinician. In terms of academics, what I would give myself is probably a 2, maybe a 3. I really don't feel that I've grown much in academia right now, reflecting back to where I was in the beginning of this semester. If we talk about last year, again, I'd give myself a 7. But if we're talking about from the beginning of the fall to right now, I'd probably give myself a 3. Why that is, like I said, I feel like looking back into myself and being introspective, I didn't put manual therapy and statistics and probably parts of clinical as a priority in terms of clinical practice. I had a new job and I wanted probably 100% of my effort to go into clinical practice, which is impossible when you're, there's other things on your plate, but I don't think I've grown enough to be content. So where I want to go in the spring, I'd obviously like to bump that number up to a 6 or a 7. So what I'm going to do is kind of take a step back over this break and really ask myself what's more important to me. Is it clinical practice? Is it the classroom? Is it interacting with my classmates, or is it interacting with my patients? And I think for me, they're about equal in terms of priority and what is most important to me. However, I don't think I demonstrated that this semester. So putting in maybe a little bit more into academics this semester, because I put a little bit more into clinical practice last semester, I think that'll help me obviously feel better in terms of where I'm getting most of my growth from. I also think that now that data collection is finished, I can again take a step back from that and refocus, because there was a couple week period where 100% of my effort was going into data collection and none of my effort was going into my academics or my clinical practice, which is a problem. So trying to balance those three things were very difficult for me this last semester. So I think really what all of my goals boil down to is balance and making sure that I'm growing as a clinician, but also growing in the profession. So that's what I plan to do, and thank you.